Hi there, I'm Doug and I am the developer of Emotional Attachment Behavioral Therapy. In today's video, we're going to discuss the third of the primary objectives of EABT. But first, let's review a few things. Emotional Attachment Behavioral Therapy is a therapeutic model based on attachment theory, which emphasizes how our attachment styles interact with our unhealthy behaviors and tendencies. In EABT, the participants will begin to learn more about their attachment styles and personal attachment characteristics, identify their core attachment stressors and where they stem from in their life, learn their physical, emotional, and mental symptoms of trigger activation for early onset intervention, identify and practice new coping skills to improve their ability for healthy responses, gain awareness of their negative core beliefs connected to their attachment stressors and work to change them. Learn how attachment patterns have been passed down through their family and how to begin to break that cycle. And increase the levels of secure attachment towards themselves and others to improve their relationships and quality of life. In the last video, we went over the second of the primary objectives of EABT, which is identifying their core attachment stressors and where they stem from in their life. In order to understand the core attachment stressors that most impact them, the participants take our childhood attachment quiz. This assessment is structured similarly to the attachment style quiz. However, after completing this quiz, they will know what experiences from their childhood are most connected to their core attachment stressors. After identifying the childhood experiences that most impacted them, the next task is to identify unmet needs that correlate to those experiences. To accomplish this, we have the participants identify the biggest unmet needs that connect to each of their top 5 childhood experiences. Core attachment stressors are comprised of unmet needs that stem from our previous experiences in life. The second objective of emotional attachment behavioral therapy is how we quickly and safely get to the root of the problems. Identifying core attachment stressors and where they stem from in life will help inform a great deal of the work we will do moving forward. One thing that makes EABT so unique is the dual-prong approach of not only working on your current areas of need, but the core areas that initiated the problems in the first place. In today's video, we're going to dive deeper into the third of the primary objectives of EABT, which is learning their physical, emotional, and mental symptoms of trigger activation for early onset intervention. In order to understand this, we have to begin with what is a trigger and what is trigger activation. A trigger is a stimulus that elicits a reaction. In the context of EABT, trigger means something that brings on or worsens symptoms. This often happens to people with a history of trauma or who are recovering from mental illness or behavioral health issues. In the previous video, we discussed core attachment stressors. These stem from childhood experiences and unmet needs. When something triggers these core attachment stressors, it can result in a response. Activation is the response the person experiences due to the trigger. In the context of EABT, we focus on physical, emotional, and mental responses. By learning their core attachment stressors and personal symptoms of trigger activation, participants increase their ability to intervene on these patterns in healthier ways. In order to accomplish this, the next thing we want the participants to be able to do is to correlate their attachment triggers to their childhood experiences and unmet needs. Let's use an example to better understand this pattern. Jim has identified from the childhood quiz that one of his top experiences that affected him was that he could never rely on his caregiver to meet his physical or emotional needs. He grew up in a single-parent household where his mom was doing her best, but had to work 2 jobs to pay the bills. This left Jim alone a lot at home as a child. Jim has also identified that one of his top unmet needs that connects to this experience is the need for security. Fast forward 30 years and Jim has an argument with his wife. She is upset and chooses to leave the house to cool down. As Jim is sitting there in their house alone, this triggers how he used to feel as a child and those unmet needs of security. Quite often in situations like this, the person is unaware that they are activated or what is causing it. This can result in unhealthy reactions. However, Jim has been identifying these areas and is able to recognize that he is being triggered. This leads to an increased ability to respond in healthier ways. Besides identifying their core attachment stressors, another way we help participants identify these patterns is by learning their symptoms of trigger activation. These symptoms can manifest in physical symptoms, emotional symptoms, or mental symptoms. So how do we do this? The participants complete an exercise where they identify their top 5 physical symptoms they tend to experience, top 5 emotional symptoms, and top 5 mental symptoms. So what are some examples of these kind of symptoms? Some examples of physical symptoms are having an elevated heartbeat, or sweating excessively, or shortness of breath, or having difficulty sleeping, or uneasiness in your stomach. Some examples of emotional symptoms participants might experience are, for instance, feeling anxious, feeling like you have no control over your emotions, feeling an urge to run away or escape, having unpredictable changes in mood, or feeling emotionally numb. Some examples of mental symptoms that can be experienced are having negative thoughts about yourself, or having ruminating thoughts, or being bothered by little things, or having foggy headedness, or difficulty concentrating. We then have participants look at trigger patterns that could happen for them. We do this by having them look at their top core attachment stressors and what symptoms of trigger activation would be likely to occur. By studying these cycles, they have a better chance of intervening in a healthy way. The third objective of emotional attachment behavioral therapy, learning their physical, emotional, and mental symptoms of trigger activation for early onset intervention, is a crucial component in this model. This increased awareness around these patterns will open the door to possibilities of improving healthy responses and reducing negative outcomes. For individuals that have developed insecure attachment styles, EABT can help. We can begin to work with you on your attachment patterns while also increasing the levels of secure attachment in your life. To learn more about EABT, follow this link to our website where you can begin your journey with our attachment style quiz. Thank you so much for joining us today. In the next video, we're going to be going over the fourth of the primary objectives of EABT, which is identifying and practicing new coping skills to improve the ability for healthy responses. If you enjoyed this video, please give it a thumbs up. And if you want to show us your support, please subscribe to our channel and ring that notification bell so you can be notified of all the latest videos that are coming out. Thanks again for joining us today. Take care.